Okay, so today we're going to be doing the postpartum assessment. So I'm going to start by reviewing the mother's chart, and then I'm going to introduce myself to the patient, wash my hands, and perform preliminary actions. I'm going to obtain a birth history from her as well as previously looking at the chart, and then I'll obtain vital signs from her, and then while maintaining privacy and maintaining dignity throughout this, I'm going to assess the different parts of the bubble HE, which is an acronym to remember the parts. So I'm going to start with the breasts. Typically you want to wait because it's ideal until she's breastfeeding, or if she's not breastfeeding you want to avoid stimulation, so just observe and look at them. You should be checking to see if there's cracked nipples or extra redness, or if you notice lumps or engorgement. So when the baby's feeding, you want to be looking to make sure there's a correct latch, and if not, help correct the latch or consult a lactation consultant or someone who can help correct that. And then we're going to move on to the uterus. So for the uterus, the day of delivery, after the baby's delivered, it should be at or a little bit above the umbilicus, and you're going to feel a hard fundus, which is going to be like melon shaped. And then if it's boggy or spongy feeling, you're going to want to do a massage and let the proper people know immediately, such as your nursing instructor or the nurse assigned to that patient. And then we're going to move on to the bladder. So if there's a distended or full bladder, that can inhibit the fundus or uterus from contracting like it's supposed to, and it can encourage hemorrhage. So you want to make sure she's voiding, and you can just simply ask her, are you voiding your normal amount? Are you able to void? And then we'll move on to bowels. So you can listen for bowel sounds, and you want to ask her, have you had a BM yet since delivery? She could be afraid to due to pain, so just ask her. And then for lochia, that's going to be your vaginal discharge after delivery. It's going to go from rubia, which is bright red, to serosa, which is lighter pinkish red, and then alba, which is going to be white or clear. You're going to want to be able to quantify the amount of discharge. So you can do this by weighing the pads, or determining how many pads she's going through in a certain time frame. And then for the E, for episiotomy or perineum, or surgical incision from a C-section, you want to be looking for redness, erythema, edema, drainage, and if it's approximated. And you want to be checking for signs and symptoms of infection. So then for Homan sign, for the H, we don't actually perform Homan sign anymore, but you do want to look at the patient's legs and check for redness, pain, because she could have a possible DVT. And then for emotional status, you want to be looking at how the mother is bonding with the baby and making sure that the appropriate attachment is being performed, and she's not avoiding the baby. And you want to be checking for signs of postpartum depression so you can get a jump on it if you see signs and get her treated properly. And then I would perform my closing actions, make sure she's safe in bed, see if there's anything I can get for her, wash my hands, and I will document my findings. Thank you.